Welcome back. You're watching McLaren Port Huron's Today's Health. We're talking about wounds that will not heal with infectious disease specialist, Dr. John Brooks. Dr. Brooks, can you just review those treatment options for us again?
Absolutely. So at the Wound Center, we have treatment options, some that are relatively simple and not high-tech, and some that are very high-tech. So we do things that are called debridement. So debridement is when we use a surgical instrument to clean the base of the wound. When we debride a wound, that is to stimulate it so that it is acting like a fresh wound, so our body's normal healing processes come back to life and help the wound heal. We numb up our patients and we give them lots of options so we're not causing them a lot of pain. That's a very common thing. Then we have a lot of wound products, and some of them are really cool because they're based like on seaweed. They're very natural. We have collagen-based products, we have growth factor-based products, we have products that have silver in them. Ionic silver reduces bacteria, and it helps inhibit what's called biofilm. Biofilm is the microbiological environment that grows into a wound that inhibits it from healing. We, of course, have a team of doctors, including several surgeons, who can then help us if a wound needs true surgical debridement in the operating room. They can do that for us. We have a vascular surgeon, so if somebody has a bad blood vessel, they can help us open blood vessels to get blood flow to a wound that wasn't working. So we have lots of options, and of course we have hyperbaric oxygen therapy. That's our top technology.
As even listening to you, I'm thinking if I had a chronic wound, that would just help me feel so good to know you got it all covered. And
that's our job.
You'll keep working on it, yeah, and you do it very well, it sounds like. Tell me about growth factors. What is that?
So growth factors, our body normally uses growth factors to help us heal. So when you have an injury and you get a cut or you get a fall, you get a scab. When you think about that scab, it's not a dead thing laying on your body. It's a biologically active part of your system. And at the bottom of that scab is where your cells are at that are releasing chemicals that stimulate your body to heal. And I like to think about it like construction workers. So, you have a hole in the road, they're going to come by, they're going to put something in there, they're going to patch it up. Well, that's what your body does. It has to fill it in and grow it and then put skin over it, because you have to have skin on the outside to finish the wound. So it happens in a sequence and in a steps. And our body uses growth factors naturally to make that happen. We do have some external growth factors that we can use to also help wounds heal that are applied topically with dressings.
Wow. I'm interested in the antibiotics that you use. Are they different than the antibiotic I would normally get from my physician?
It truly depends. So it would really depend on the depth of the wound. So if a patient has diabetes or they have another condition and their wound is extremely deep, it goes down to the muscular tissue or goes down to the bone, then they're going to require antibiotics by vein. The oral antibiotic therapy is not nearly strong enough to get to those tissues and to fight off the serious infections that people get to allow the healing.
We talk about hyperbaric oxygen chamber, and that sounds very high-tech, sci-fi kind of thing. What actually is a hyperbaric oxygen chamber?
So what we have is that we have what's called a uniplace, or a single patient chamber. And so what it is, it reminds me of the old Disney movies where it's like glass. Ours is acrylic chamber that's completely see-through that the patient is put into, and they actually get pillows and they get to relax. There is a TV that they get to watch through the chamber. Nothing electric goes in the chamber. 100% oxygen, no fires allowed. And so it's an environment that's then created with 100% oxygen and 2 times atmospheric pressure, so twice the pressure around us. And our U.S. Navy, actually, we can give them all the credit to why we know about this. So back in the day, World War II and a little before, divers would get something called the bends and get sick. And they would put them in a bell and pressurize them with oxygen to save their lives. And what they figured out is these soldiers and Navy guys would come out of the water with wounds, and their wounds would miraculously heal. Well, somebody put it together and said, oh, we wonder if it's this environment. And they did studies and found out that, lo and behold, hyperbaric oxygen heals wounds that don't heal in other ways.
Why does that much oxygen, how does that help a wound heal?
So what we understand is in what's called the pathophysiology, what's going on inside. In that environment, the body grows new blood vessels. So the growth of new blood vessels, we really can't do in other ways. We don't have good ways to do that. Chemicals don't work, and surgically I can put new flesh on you, but it doesn't grow you new blood vessels. But the environment stimulates the body to grow new blood vessels, so that tissue now gets oxygen, and oxygen, of course, is the molecule of life. least on our planet, right?
So I know this is the only hyperbaric oxygen chamber in our area. Why is that important to have that here?
So the best part of being able to have hyperbaric oxygen therapy here is people don't have to travel, because it is daily. Hyperbaric oxygen therapy is a Monday through Friday process, and they're here in the wound center for about 2 hours. So there's a time commitment. So if somebody has to drive an hour or 2 hours to the Detroit area, it's difficult to take 2 or 3 or 4 hours more of your day to receive the treatment.
Absolutely, and I'm sure compliance would go down then, because things come up and you can't do 6 hours or whatever it takes.
Exactly.
This has been really great information. Do you have any closing comments for our viewers?
Well, I just want to make sure people understand that we do have a wound healing center here at McLaren Port Huron, that we're here to help take care of patients. They can get referred either by their physician, or they can self-refer if they have a wound that's been present for 30 days.
Thank you so much for joining us.
Thanks, Barb.
Stay with us. We'll be right back.